Hi guys, welcome back to Veterinary Nursing Diaries. My name's Sophie McMurray and this video is all about azotemia. So first of all, when we think of azotemia, we need to think about, first of all, what it is, and then we need to think of the origin. So where does it come from? Where is it originating from? So we always think of azotemia is linked to the kidneys, which on many occasions it is, but that's not the only thing that can cause a patient to be azotemic. So first of all, what does azotemia mean? So the definition of azotemia is an abnormal level of nitrogenous waste product within the bloodstream, i.e. your urea and your creatinine. Now, there's three different areas which we need to think about when we're thinking about the origin of azotemia, and they are pre-renal, just meaning before the kidney, post-renal, after the kidney, or it could be within the kidney itself. So pre-renal just means usually it's caused by a hypoperfusion. So maybe the patient's dehydrated, or maybe they have hypovolemia, hypovolemic shock. If the perfusion is affected, then the waste products aren't being carried to the kidneys in order for those waste products to be excreted. So quite often this is easily rectified. Once you place the patient on fluids and you just correct that perfusion issue, then the azotemia should come down, and it doesn't have any long-standing effects on the kidneys. This can also be things like congestive heart failure, which affects your perfusion. If your heart isn't pumping correctly, it's not sending the blood to the kidneys as it should, and therefore the waste products are starting to build up. So maybe it's from within the kidney itself, and this could be caused by an acute kidney injury. Maybe the patient's had a toxin. Maybe there's a chronic kidney disease going on there, commonly in your little old cats. Maybe there's a renal disease itself, such as glomerulonephritis. And there's other things that we can do, other tests that we can do to try and help us identify where this problem is coming from. So if you think that your azotemia is pre-renal, you can do a PCV and a total protein alongside. We know that with dehydration, we will get an increase in our PCV and an increase in our total protein. So that might tell us that this patient is dehydrated, and therefore this may be a pre-renal azotemia. Your acute kidney injury, you tend to see a hyperkalemia, not always, but you usually will see a hyperkalemia with an acute kidney injury, whereas with a chronic kidney disease, you may see a low potassium value. Hypo and hyperkalemia just meaning high and low potassium ranges within the bloodstream. And then finally, we may see a post-renal injury. So this could be your block cat, any kind of urinary tract obstruction, and post-renal just means anything after the kidneys. So anything to do with that urinary tract that could be stopping that urine from being excreted from the body. And quite often, again, once we rectify this problem, so we unblock the cat, or we repair the ruptured bladder if the patient's had an RTA, then those kidney values will start to come down. And it's important that usually these can be sky-high renal values. It's important that we don't instantly say, oh, that's too high to be rectified. Get rid of the problem that's causing the azotemia and then start to look at if it's coming down. If it is, great. Some of them could have long-lasting chronic kidney disease, but not all of them. So it's important that we are monitoring them afterwards and don't make that judgment too soon. Now we'll talk a little bit about the two waste products individually. So BUN. So they're both waste products, and BUN is created from amino acid metabolism. So when your amino acid is metabolized, it's broken down into ammonia. Your ammonia is then taken to the liver, where it's converted into urea. Now, this is then taken to the kidneys, where it's excreted renally. And if you have an increase in your urea, then this could be due to a couple of different things. So your renal function is assessed on the body's ability to remove this urea from the circulation. And if your kidneys are impaired or the function is impaired, then you may start to see a buildup in your urea. There are a couple of other things that can cause an increase in your urea, and that could be a gastrointestinal bleed. So if you're bleeding into your GI tract, blood is then digested again. It's converted into ammonia, which is then converted into urea. And therefore, you can start to have an elevated urea because your body is just digesting the blood from your gastrointestinal tract, and it's just adding to your normal values. Also, it can be caused from strenuous exercise. So urea is made from part of your amino acid breakdown. So if you're exercising your muscles, you'll have an increase in that amino acid breakdown, and therefore an increase in your urea. And also young patients may have a mildly increased urea as well, and that's totally normal. So BUN can be a blood test that we look at for renal function, but it cannot be used as an accurate indicator of renal function alone. Now, creatinine, this is slightly different. So it's found in skeletal muscles, and it's formed as part of the breakdown of creatine. So this enters most of the body's fluids as the body breaks down those muscle cells. And therefore, the total volume of your creatinine within your bloodstream is reflective directly of the total muscle mass of that patient. So you can see in the background here, there's a greyhound. They have a really high muscle mass and they're constantly exercising. So they will have a naturally elevated creatinine on their bloods. And if they are maintaining a constant level of exercise, so maybe in your working patients, then that creatinine will also be reflected in their blood test as well. But then if you think of it in the other scenario, so maybe you have a renal cat who is really thin, underweight and emaciated, if their muscle mass is decreased, you may not end up with the blood results that you're expecting. So take your hypothyroid cat, for example. So they have an increase in their metabolic state. So they tend to present to us quite underweight with a lot of muscle, a lot of their muscle already broken down. So they have a smaller muscle mass. So if you then expect to see renal disease or chronic kidney disease in these patients, you may be surprised that your creatinine is actually within the normal limits when you run those bloods. And that's because it's instantly just reflecting the patient's muscle mass. So these cats have a low muscle mass, therefore their creatinine can only be low as well. So in these patients, it's important to take that on board and consider it when we're thinking, does this patient have a chronic kidney disease? And if it is a hypothyroid cat, for example, once they're put onto those thyroid medication, then they may come back in a month or 2 months' time and their muscle mass has greatly increased. So that's when, if we start to do blood tests on those patients then with a normal muscle mass, we might then start to see azotemia. And that's a true reflection of the patient's kidney function and the patient's kidney disease. So there's many different things that can cause an azotemia. Little rundown on what urea and what creatinine is. Try and remember those things the next time you're evaluating a patient's blood results in practice. And hopefully that can help you interpret what's going on with your patient. I hope you've enjoyed it. I hope you've taken something home that you can utilize in practice. If you haven't done so already, hit subscribe and watch a few more of our videos. Thank you.